All right, today I'm going to show you how to do what's called a cap change on our umbilical venous catheters. They're also called claves, microclaves, but essentially we're changing these caps. So in reality, you would have your existing infusion going through your ports of your UVC. You would disconnect those, and then we're going to change and put new claves on. And this is part of a central line infection bundle to try to prevent central lines with our umbilical lines. So before you did all this, you'd want to gather your supplies. So you will need a pair of sterile gloves. You will need one sterile saline flush for each of your ports. So since this is a dual lumen, you would need two. If you only had a single lumen UVC, you'd only need one flush and one new clave. You'll need alcohol pads to scrub the site, and then grab some 2x2s that are sterile so you can grab the line with your sterile gloves. So I'm going to go ahead and I'm going to put on my sterile gloves to start. If your patient's in an isolette, you would want to open the portholes before you put on your sterile gloves. I learned that the hard way. So I'm going to actually drop everything onto my sterile field, which is my gloves. So your new fluids are up. You would want to go ahead and prime your new fluids. I recommend priming the trifuse with normal saline. If you choose to prime the trifuse with the existing fluids, so if you choose to prime all the way down to the end with your TPN and with your lipids, if you had lipids infusing as well, just to make sure that you prime your med port as well with normal saline. Otherwise, when you hang your med, you're just going to infuse all the air that's sitting in there. When you are priming your tubing, you want to make sure you leave this cap on the end of the trifuse. So you'll grab your infusion tubing, a trifuse, and then again, leave this cap on there so that can stay nice and clean. So you can put your tubing into your bed. We'll go ahead and we'll put on our sterile gloves. This isn't technically a sterile process, but we want to keep it as clean as possible. So using sterile gloves kind of helps achieve that. So after you've opened all of your sterile supplies and you have your sterile field ready to go, you have your gloves on, we need to prime the claves. So we actually are going to use a sterile saline syringe, one for each clave. It cuts down on central line infections if you use two different syringes versus putting the same syringe on both claves. So now we need to scrub our line. So we want to keep this sterile as clean as possible. So you can pick up your line with your sterile gauze. So now we need to remove our caps so they just screw off. You will now take your alcohol, which you will have opened before you started, and you're going to scrub the hub of each of these, and we want to scrub it for 30 full seconds. Okay, that was 30 seconds. Now we're going to scrub the other one again for full 30 seconds. And we'll pretend that was 30 seconds as well. An important thing as well with scrubbing is we want to make sure that the alcohol is dried completely before we put our new clave on. So our alcohol looks dry, so we'll screw on our new clave. And now that your open port is now closed with a new cap, you don't have to stay sterile, so to speak, anymore. So you have this all hooked up, ready to go. You can take your new fluids. Again, you're going to want to hook up your primary infusion to the longer of the two ports because we always want to infuse our medications as close to the patient as possible. So you can just unscrew this, put it onto your new cap, make sure you unclamp it, and then you can re-begin your infusion. And if you're not hooking up a med line immediately to this port, you're going to want to put an orange cap on the top of it. And that is how you do a sterile cap change. Again, those are done on Sundays and Thursdays when you do your full tubing changes. So when you remove your clave, after you have scrubbed it, you may notice that there's a little bit of air or free space in the line. You may just need to squeeze a few drops in from your cap, from your syringe, as you screw it on. Another tip when you are actually securing your lines, you always want to try to make sure that the numbers are up. There is lines all the way around all of these umbilical lines, but it's helpful when you're measuring to have the numbers on top. Additionally, if you can kind of swirl the line on top of the duoderm and under the tegaderm, it secures the line a little bit better because there's more line that is secured under the tegaderm versus if you just did it straight out with the tegaderm on it. It just keeps it in a little bit longer. Again, the lines will always be sutured down. If there is umbilical tape around the umbilicus from insertion, that should be removed at 24 hours. You always want to have the diaper folded down. You don't want the diaper going above the line. And when you do secure your line, you do not want the tegaderm covering the umbilicus. You want it alongside of it.